Welcome to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, doctor of physical therapy and owner of an award-winning clinic, Foundation Physical Therapy, here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, injury prevention, overall health, bringing you expert insights from leaders across various healthcare fields. Please note, while we aim to provide you with the best knowledge and advice, the opinions shared represent those from experts and is not a replacement for professional medical advice. Let's revolutionize healthcare and wellness together. Today I have with us Wesley Geer. She is a board-certified orthopedic physical therapist at our South Jordan location. She comes with a variety and expertise in the orthopedic realm. Today, we're going to talk about patient-centric focus. I know you've heard this story as well. And if you're a viewer on our podcast, you've probably had this experience. But my wife went to multiple providers. She had a hamstring strain after having a baby, and we went through 6 providers over a 3-year period. And I remember she went into this provider specifically, and the first thing this provider said, without asking her any history, anything like that, said, "You should stop drinking energy drinks and stop eating sugar." She internally was like, "I don't drink energy drinks and I don't eat sugar very much. And how is that going to help my hamstring strain?" And he just gave her a podcast, dismissed her, and sent her on her way. And too many patients experience this. And the purpose of this podcast is to get the whole healthcare team to work together, including the patient. Patient advocating for themselves. And Wesley's really good at maintaining a very good patient-centric focus. So Wesley, have you seen this in the clinic with working with patients, experiencing these types of things?
Yeah, and I think it's really not that hard to do once you get used to it, and honestly makes this job more fun and more entertaining to be on that team with your patients. We joke sometimes at our clinic that, like, yes, I know you're injured. I don't always know if it's your left shoulder or it's your right shoulder, but I do know the name of your dog.
Mm-hmm.
Yeah.
Yeah, absolutely. You know, it's sometimes from the patient side, they have multiple injuries, and it adds some complexities to what we do. Talk to me about the complexities that you have to deal with in the clinic when someone comes in and they're like, "My shoulder hurts, my knee hurts, and my back hurts." Tell me about some of the things that you have to deal with.
Right. So a lot of times people will come in and they'll come in with the referral for one injury. They'll say shoulder injury. And then I'll get talking to them and they go, "Oh yeah, also my knee hurts. Also my toe hurts. Oh, also I've had back pain for 20 years. And from the patient's perspective, they're coming in to talk to someone who's going to help them with their problems, when sometimes it's like, hey, we really need to start with the one problem. We need to pick the most important problem to you and go from there. Because, if I spread out all my time across all your injuries, it's going to make the process slower. Now, that being said, there's a lot of times where a shoulder injury is related to a neck injury. And when these things go together, that makes sense. But when I come in with multiple problems, like, yes, I'd love to help you with all of them, but let's start with one and let's go from there. And that's really us trying to be effective for you, not trying to ignore other areas that you're having problems in.
I love that you use the term effective. A book I read, Covey, one of Covey's books, talks about being effective with people, but efficient with things. Right? So many times in the healthcare world, we want to be super efficient. You can imagine going home to your spouse and you're like, "Okay, I got 10 minutes to hear about your day. Go." And I set a timer, right? We do that in healthcare all the time, right? Because we are pressed for time. We have patients that are waiting on us. But what's your advice to both the patient in these circumstances, and what's your advice to providers when they're feeling this on both sides?
I'll start with the advice to providers. And my advice to providers is to take the time to, one, explain the situation you're in to the patient, right? So say, "Hey, we have this much time and my goal is to get this better." But then on the flip side, so if they come in with a shoulder referral, but then you talk to them more and it's really this other area of their body that's limiting their function the most, I think it's our job to talk with the patient to determine where we're going to make the biggest impact in their life.
Absolutely.
And there's a level of respect sent right to the referring provider, but I think we can get through that with a simple phone call and communication on, "Hey, I know you sent this person for this. This is what I saw in the clinic, and this is the direction we're going to take the plan of care, because that's what's going to make the patient more successful in movement in their life. And then if I'm, talking with patients, I explain a similar thing, is that, hey, we have so much time. This injury is going to take this amount of time. What do you need to work on most in your life? And really get them to sit down, talk through their goals, talk through the movements they have problems with. And then together, that's the key part, is together we figure out what we need to address first. And then always leave the door open to say, hey, let's tackle this first. And then we're going to check on this, and give them a timeline that you're going to come back to that. Yeah. And then the provider, you got to come back to that. You're going to be accountable.
I love that because you paint the picture for where we're going, right? You're letting them know this is a long-term thing. Yeah, we're going to get through all of this, but let's start here. And then you remember the other things that they have going on, right? Maybe you're, putting a few things in their note, but you're asking them, what is the main limitations you have in your life right now? What is this stopping you from doing? It's not pain that brought you into our clinic. It's literally something you can't do. What is that thing? And then you figure out, we use the term saliency, right? What's salient to them? What's important to them? They want to be able to lift their grandkid off the floor for Christmas, right? Put the star on the top of the tree. What's limiting their ability to do that? The back pain, right? How can we solve that? Let's go through an exam and figure out what's going on. But I love how you paint the picture of where we're going, because sometimes setting those expectations at the beginning are so important. Because people come in with 5 injuries, and we try to determine what's the most important one to you. But you make it patient-centric, right? And you don't say, okay, I think the back pain's the most important. You ask them, what is the most important thing to you? Let's work on that first. How do you feel about that, right? And it takes a little extra time, but sometimes I would say most of the time it actually saves you time.
In the long run, it's certainly going to save you time, and it's going to get that patient on board with your direction, and it's going to get them to buy into this process. And if we take that extra time on the beginning, then they're here, and then we have that patient for this plan of care, and they trust to come back to us when something else comes up.
Yeah, I saw this GIF. Is it GIF or GIF? I don't know.
Oh gosh, I don't know, Brad. I'm a physical therapist, not in computers, so.
I saw it. We'll stick with GIF, but I saw this GIF that said, it was 2 lines. It was like a grocery store line, and it said, the people lining up for medication and surgery and injections was really long. It was like hundreds of people. And the people signing up for exercise and physical therapy, the conservative stuff, it was like 2 people in it. All of us, we live in a world that is fast paced, right? We want fast food fast, right? We want to be able to get access to information very quickly, right? But the things that are really long lasting, the things that are really going to make an impact, take time. Would you agree?
Yeah, I'd agree. And I understand life is busy. We have family, we have work, we have other commitments in our life. And asking someone to add in exercise, for some people, great. They already like exercise. For some people, that's a big chunk of time. And I think, the injection, the medication is quicker and it's easier. And it's really just, what do you want? Do you want to get this better long term? Do you want to get this better short term and then deal with this problem for a long time?
Yeah, I love that. Because sometimes we put what we want ahead of what the patient wants, right? I grew up in the motocross community. I remember I was in a race. I was in a championship series, and I was first place in the series. And I had broke my thumb, and I had four pins sticking out of it, and I had a cast on. So they're external pins. And I remember I had to finish the last race of the season to take first place. If I just showed up to the race, then I took the championship. Great. But I had to actually race, right? And I remember my doctor said, no riding. He looked at me in the eye, you won't ride, right? And I just thought, I'm 17, I'm definitely going to ride, right? But I didn't want to tell him that. But as a physical therapist now, I have conversations with people and I say, whatever you want is what I want. If you're going to do something dangerous, I want to know about it because I want to protect you as much as possible. I want to explain the consequences of things going wrong, but I also want you to do it in the safest way possible. So I'll teach you how to do it if you're going to do it. But I don't want to be on the outside and not be aware of the situation because you might get hurt and you might not know of the ramifications of what could happen, right? And I think it's really important that we're on the same team. Our patients understand, I'm in this with you. And I get that this is hard. This is what it's going to take. This is the effort that you're going to have to put in. This is what you're going to bring to the table. This is what I'm bringing to the table. And we're going to do this together, you know?
I think we need to give our patients enough credit. They might not have the knowledge we do, but they're smart. And if we give them the knowledge, then yes, it's their decision to take that knowledge and interpret it. So I agree with you. Let's educate you. I'm not I'm not going to make the decision for you, but I'm going to give you all the tools so that you can make a well-informed decision, right?
Yeah. What do you think about, when people have done, all the things and they don't have any answers, and maybe you don't know the answer anymore? What's kind of your go-to? I think about these people that just so desperately want answers. And sometimes those answers come and sometimes they don't. Sometimes there's a lot of things that we don't understand about the human body, even knowing we're experts in this area. But tell me your thoughts. Like, what do you do in those instances?
Well, the first thing I do is I'm happy to say to the patient, you know what? I don't exactly know what's going on here.
Yeah.
Right. So you
This
admit
has
that
come
you
from
don't
a
know.
board certified PT.
There's a
knows her
lot I
stuff,
don't
right?
know, right?
Yeah.
So that's
I think that's when you know you have a good provider. Someone that will just admit, I'm not 100% sure what's going on here.
And I think it's really easy. Yeah, some people they'll tell you that they want an answer.
Mm-hmm.
But in the end, what I find is they want to feel better. So sometimes if I can't provide an answer, but I can make them feel better, either emotionally, physically, mentally, then we can get beyond exactly having a concrete answer to that question. Now, that being said, I'm certainly going to go look up what I can find. I'm going to ask my colleagues. I'm going to ask my friends. I'm going to, go to the literature. And if after that, I'm still not able to explain it to the patient, then at some point we have to say, you know what? Yeah, we don't know things about the body. Science is still emerging here. And here's what I don't know. And here's what I do know.
Yeah.
And then I stick in the land that I do know and we go from there.
Yeah. What I found, you've probably seen this as well. If you have a good relationship with the patient and you've talked to them and they know that you're doing everything you can for them. You're reaching out to the local surgeon, you're reaching out to the local pain doc, and you're collaborating as a healthcare team. It actually has a very positive effect on the patient. And sometimes their pain actually decreases, right?
Yeah.
When they know they have this team that literally validates them, they listen to them, they deeply care. When I get to the end stage and, people are, 50% better, I'm not arrogant enough to say everyone gets better with PT, right? It's just, we implement the science. It's our job to implement the science. It's the patient's job to do their role. But ultimately, physical therapy doesn't fix everything, right? I'm a huge advocate that it'll fix 85% of things, but around 15 to 20%, we need to get other people involved, right? But I think when we let that patient know that they have someone in their court that cares about them, and we listen to their story, they understand that they have this team of this community of people that are helping them, right? And I'll get to that end stage and I'll say, let's take a month off therapy. I'm going to keep in contact with you. I'll keep you in our system, and let's talk in a month and see how things go. Maybe taking a break from therapy and you just keep your activity up. Just try not to work in pain, and let's just see where we get. And then let's touch base in a month. And then we figure out another plan from there, But if they know we care about them, I feel like it makes a huge difference. What are your thoughts?
I'd agree. And I wouldn't underestimate time, right? The right time, the right place, the right treatment. We might be the right treatment and we might not be at the right time or the right place in their life.
Huge, yeah.
But if they know that we're here for them and they know that somebody is going to follow up, then that can make all the difference in the world, right?
Mm-hmm. Absolutely. And I definitely want to highlight the importance of using each other. We got great chiropractors in the other. We got great massage therapists. We have personal trainers. We have pain physicians, surgeon. Everyone has a role in this healthcare system, and timing is everything sometimes, and getting everyone involved. But sometimes it takes just a little bit of effort to contact that doctor down the street to get a consultation, right? And realize we don't have to have silo care. This is a team effort, and make sure we include that patient. And if we listen to that patient, I would say 80% of the time, I already know the diagnosis based on their history and what they're telling me, right? Sometimes people can trail off, but I think one of the things that we focus on in our practice is we teach our clinicians to stay in control, not be controlling, but stay in control of the conversation. And sometimes I'll stop patients and I'll say, there was a study someone talked about in rounds the other day that said the average provider interrupts their patients after 10 seconds of them speaking, right? That's a huge deal, right? But I think sometimes the patient needs to understand, let me guide the conversation and the questions I need to ask. And then can you fill in at the end if I missed anything, right? Because sometimes we can trail off and it wastes a lot of time, right? But if I can guide the conversation, it really helps. What would you say?
I'd agree wholeheartedly. I think one of the best questions I added to my eval is I added at the very end and I say, is there anything else about your pain, your back pain, your shoulder pain, or about your life that I need to know that I missed?
I love that. Yeah.
And it's this wonderful open-ended question. And I know it's coming. They maybe don't know it's coming, but during that eval, I can be efficient. I can get the answers I need. And then at the end, I can open it up and let that patient know, hey, you have the final word, right? That's the key. They have the final word. And that I care about, yes, their injury, but I care about how that is impacting in their life. Because we have a finite amount of time and I need to know what I need to know so I can help you. But there's a balance, and some days I get it, I nail it, and some days I don't nail it, and that's okay.
For sure. One patient's late, and the other one shows up early. It just makes it challenging for sure. Any other last tips for a patient-centric focus for the provider or the patient?
My final parting words are just, your patient has a life outside of PT, and just take a minute or so to learn something about your patient that's not related to their injury, and that goes a long way.
Yeah, you treat people as people.
People are people,
and we have to understand that these are human beings, people that love them, right? And care about them, and if we remember them as people, we treat them different. But thank you for joining us today, Wesley.
Thanks
we appreciate your
expertise
to the area.
This was great.
And thank you for all you do for our community.
I love working here, Brad. Thank you.